Hello and welcome everybody on my unique channel. Today I have invited Dr. Sadia Khalid from Pakistan, and I would like to give a sort of a short introduction about Dr. Sadia Khalid. That she is a family physician, health specialist, member of Council, World Organization of Family Doctors from the rural organization or the council as well, and public health speaker, certified e-coordinator for healthy aging care. So, welcome, Dr. Sadia Khalid, on this
Thank you so much for your kind introduction and thank you so much for having me here,
platform.
Kiran. Thank you so much, Kiran, for your kind introduction. Kiran, I can't hear you.
Yes, Dr. Sadia, can you hear
Yes,
me?
yes, I can hear you now.
Okay, I don't know. Maybe today internet is acting funny. So sorry for that. I don't know what's wrong with the internet today. So yeah, this happens. Some sort of problems are also we have to deal with when we are online. So sorry for
Absolutely.
that. And I'm back for this live session, which is going on with Dr. Sadia Khalid. And sort of a short introduction I gave about Dr. Sadia Khalid, that she is from Pakistan. She is in this health organization since long. Further, I think Dr. Sadia Khalid, you take the stage and you additionally want to say something about yourself to my audience. Please, mic is yours. Go ahead.
Thank you so much, Kiran, for your kind introduction. And yes, I've been working in the field of medicine for the last like 20 years, and being into family medicine, and as well as I'm a public health speaker. My areas of interest mostly is geriatric medicine, as well as all the concerned areas which is related to women and women health. So that's the perfect topic which you have chosen today for like to talk about women health, which is the most neglected part in our society.
Yes.
So I appreciate your interest, and I just congratulate you on choosing that topic, which is very important.
Thank you so much. As you know, Dr. Sadia, that we have to discuss on women's health. And before starting about some particular question, I think it's important to discuss certain stages of women where we think that, yeah, women most of the time in those stages, they would be suffering with different kind of problems or issues. So I think I would want you to begin with the women's different stages, as importantly those three stages where you would like to shed some light on women's issues. So please go ahead and let us just listen from your side. Please go ahead.
Okay, so women basically undergo three major transitions in her life. We all know it's related to like puberty, menarche, when the women undergo through like start of the menstrual cycle. Then comes the pregnancy when the reproductive age starts. Then pregnancy has its own issues, and finally it's the menarche. So three important stages a women usually undergo, and all the three stages carries different kind of physical as well as emotional changes. It's not
Mhm.
just the physical, the emotional changes are also very important in the life of a woman. We usually neglect the emotional changes more because we are into the physical appearances. Once it's a puberty, we have seen the girl actually undergo a lot of body changes. She
Yeah.
must have developed the pubic hair, then the development of breast and pubic hairs in the axilla, and the reproductive organs, they usually develop in this phase. And she needs guidance, a girl needs guidance at this stage from her parents, mother specifically, or from the teachers in the school. They must have the proper idea what is actually why these changes are occurring and what's happening in her body, so that they can have the good knowledge that what's happening in her body. And they usually undergo a lot of emotional changes in this phase also,
Yeah.
because the hormones
Yes.
are fluctuating. They do have
Definitely.
different kind of emotions in that stage. In
Mhm.
in our setup, people they don't talk about this. Yes, we told them that this is the age of menarche, and menarche, by the way, starts at the age of like 9 to 14, 9 to 11,
Yeah.
you must say. So puberty, pregnancy, and menarche. All the three stages carries its own problems as well as like emotional and physical changes.
Okay. All right. Of course, as we discuss about these three stages, which are very much important, so do you think that, of course, initially, when, of course, a girl having that phase of puberty, would we be thinking that she would be suffering? What I've heard, of course, like the main issue, which is normally girls they face, that's the uncontrollable pain, then they suffer with it. Apart from that, that pain, of course, I would want you to share some sort of tips and tricks to manage with that pain. And of course, with that pain, you think that, yeah, there's could be another problems or issues with young girls which you would like to share. Please go ahead.
Yeah. So you have yes, emphasized a very important the menstrual pain. Menstrual cramps or pain is usually a kind of normal thing. But if the pain is unbearable, or if the girl is suffering from too much of like pain, then she should consult physician at that time. The mild cramps are part and parcel of this procedure. Every woman
Mhm.
experience some kind of, and the pain usually occur in the first to 2 days. After that, the pain usually subsides. But initially, with the start of the menstrual cycle, the women can experience kind of mild to moderate cramps. But if the pain is unbearable, yes, she should consult a doctor for that. And the tips for catering this pain is, I always told my the young girls that when you are having this kind of pain, instead of lying down on the bed, they can have the hot compresses, have like heating pads. They can use the heating pads in the abdominal area, or they can have warm fluids. They can have a good diet during that phase and a mild walk. Whenever you are having pain, that means that the uterus is actually having ischemia. The blood supply has been reduced. So instead of lying down on the bed, they can have a like kind of walk during that phase. That is helpful in reducing the pain as well as the menstrual cramps, right? And the good warm fluids. heating pads or a warm oil massage can help you. And they should keep in puberty. The very important thing is the menstrual hygiene, which we usually don't discuss.
Most we ignore
So
it. Yeah.
menstrual hygiene is very important. If a girl is having a start the puberty, starting this menstrual cycle, in the start of the menstrual, they should have a proper knowledge how to keep the area clean, how to the wash that perineal area. We always tell the females that the women should always wipe from front to back. The reason being that if we will wipe from back to front, the anal area is full of bacteria and all that. And if they will wipe from back to front, there are chances of infections, occurring in that area. So I always tell the girls, this is very important. And, the people, they don't know. If you're washing the area, you have to wash from the front, then going to the back, right? And don't
Right.
use that back area while you're washing, and then don't use that hand again on the front area. In this way, we can, prevent a lot of UTIs, lot of infections in the perineal area. And second most important thing is they should have a proper, change of sanitary napkins after like 3 to 4 hours. Change of
Hmm.
napkins frequently. Thirdly, a lot of fluids should be taken when a woman is menstruating, and they should have a good diet, and they should have keep a proper record of menstrual period, so that the next time whenever they're having, they should have an idea, okay, now the periods are about to start. And the emotional support, that is very important. If a girl is having on the menstrual, on her cycles, she needs a proper support from the family. She needs, if she's working, she can take a break for 1 to 2 hours and things like that. So these things all will help a women in coping up with these, symptoms during the menstrual cycle.
Definitely, I would fully agree with you that hygiene is important. And as you mentioned about, like, girls should take some sort of, warm fluids, and of course, like, some sort of, heat packs, or, those packs normally are easily available. They can use it. Okay, I would like to discuss a very important question. Normally, what happens that when a woman, they get married, and of course, there will be a time of pregnancy, and after pregnancy, taking care of children, would be having a lot more stress or workload by the time, of course, not taking care of children only, of course, taking care of their household, other stuff as well. So everything should be in proper time and place. So women, they start carrying a lot of, having sort of different kind of pains, whether you can call it, and then they ignore it, and they become sort of, chronic pains. And for those chronic pains, if I just gonna give you example of, like, sciatica, fibromyalgia, or osteoporosis, of course, very very important. Most of the time, women especially, they ignore it, or plantar fasciitis. So all these pains, when they develop, what do you think, where the ignores occurred, what were the causes, or what could be preventive measures could be taken initially from the beginning, that all the women, they shouldn't, like, suffer with these different sort of pains, which would become chronic. So then that would be a bigger problem, and that would be unmanageable. So yeah, what would be your say on that?
So the women is considered to be the backbone of the family, right? Whole of the family is actually dependent on the female, the mother of the family. And yes, when the women is enter into the reproductive phase, immediately after puberty, the women are should take the calcium supplements on a regular basis. They should have a good vitamin D support. And thirdly, if they want to improve their calcium levels, they should have a good intake of dairy products in the form of milk, yogurt, cheese. If you're allergic to milk, you can have the other options in the form of cheese, yogurt. So if you're young, you can consume all these things. If some for some reasons, if a person is allergic to dietary, dairy products, then in that case they can have the supplements, calcium supplements, to to improve the calcium deposit within the body. Because the female, they have to undergo a lot of changes, starting from puberty, the menstrual cycle, then the pregnancy. Pregnancy itself carries a risk of a lot of calcium reservoirs should be there in the body, because
Definitely.
your own calcium will start depleting if your calcium reserves are not good within the body. So all the
Right.
females, I always told the females that once you entered into a menarche, you should have the good reserves of calcium within the body, because in the later stages they have to be going through the all the phase of pregnancy when they'll get married, and then in the end the menarche. So if your reservoirs will be good within the body in the start of the period, in that case the end will be good. But if the reservoirs, if your diet is not good during the childhood, during the puberty, then in future you will experience some kind of deficiencies, vitamin D deficiency, then comes a calcium deficiency, and your body will start experiencing different kind of symptoms. And yes, all the diseases which you have mentioned in the form of sciatica, fibromyalgia, back pains, this will occur if your body is not having a good reserve of calcium and vitamin D. So, with the start of
Mhm.
puberty, one should take a good diet rich in calcium and vitamin D, and they can start the supplements if they are not into taking dairy products. And
Mhm.
yes, a regular exercise that also plays a very important role. If you are having a sedentary lifestyle, you are not mobile, you are sitting on the couch all the day, that adds a lot of negative effect on your bones as well as on your muscles. So, a good,
Mhm.
active, healthy lifestyle along with the healthy food is the pillar, is the key for like a healthy body, right?
Right. Mhm. Okay, thank you so much for responding on this question, Dr. Sadia. Okay, another important issue you can call it, especially I wanted to know first because you work in in Pakistan and mostly deal with different sort of patients. So, what do you think? This mental disorder, which normally we call it post-traumatic stress disorder (PTSD), you notice in most of the time in women or in men. So where is the statistic? Where is it growing? And especially with women or men. So what would be your, sort of experience or uh, research you maybe you did? What would be your thought on that?
Okay, so post traumatic stress disorder, as the name says it all, it's
Hmm.
related to stress and trauma, right?
Hmm.
So, if a normal grief, if a person is suffering some kind of trauma or stress, is natural. Suppose if there's a loss in the family, or if there's some kind of accident a person has experienced, a normal grief for a day or two, or like 3 to 4 days is okay. But if that grief has prolonged, it has taken like weeks and weeks, and like a person is in a state of distress and trauma for like 2 to 3, 4 weeks, then we label that person is suffering from post-traumatic stress disorder. And this is very common in females as compared to males, because female being the
Okay.
sensitive and
Right.
not very expressive, specifically
Hmm.
in the countries like where the socioeconomic conditions are not good, and the women, they're not too expressive. That's in settings, the women, they always occur from post-traumatic stress disorders, and they have no one to talk about their grief. There's no one to console. The women are just sitting in the house experiencing all the negative thoughts are there in the mind. They are not socializing, they're not talking. So in that case, the women is the target for PTSD.
Right. Okay. Sure. Sure. Okay. Most important phase, or you can say the time or the period of age for women when they turn 40. Because, like, when that would be a time or the phase of 20, 30, it's completely fine, it's completely okay. But when a woman turns 40, by that time, by that age, what do you think would be a sort of necessary measure should be taken in regarding for overall health? So, what do you think? Which way should it be, taking in care of when a woman turn 40? What do you think? What would be your thought on that?
Okay, so
After 80, after, yeah.
as I already mentioned, that the women care should start at the time of puberty, right? That's the right
Right.
time that a woman should start it taking care of herself. Yes, she should have a good iron reserve, the folic acid, the calcium, and the vitamin D. Iron is important during the pregnancy. The folic acid reserves and the iron reserve should be good in having, yeah, while a person, while a female is going through pregnancy. But at the age of 40, a women should have a good, always you should have a good calcium intake in the form of supplements. The vitamin D should be appropriate. If she's having some kind of joint pains, ankle pain, or she's having the fatigue, body aches, then she should consult a doctor. So in that case, maybe she's suffering from some kind of deficiencies, and which is very common at the age of 40. The women usually experience calcium deficiency as well as vitamin D deficiency and anemia. This is very important, very common in Pakistan.
Iron
So
deficiency.
anemia, calcium
Mhm.
deficiency, and vitamin D deficiency. The women at the
Right,
age of 40, they are at the risk of developing all these deficiencies. A
right.
woman should have a good reserves of calcium, vitamin D, and she should be, 40 age doesn't mean that she is now in a state of, she should lead a retired life and she should, quit all the things because she's getting old. No, that's the right time. That's the right, time to start a woman to lead an active and healthy life. She should have she should go for an exercise or whatever is convenient, yoga or the breathing exercises, or she should have a proper, or if nothing is available, she can go for a walk. She can start, walking, starting with the 10 minutes per day, then increasing, keep on increasing for 15, then at least, 30 minutes of walk thrice or 4 times a week is very important for a good physical and mental well-being. That is very important. A good lifestyle and a good diet after
Mhm.
40 is must for a female, right?
Right, right. So, good lifestyle and of course, like healthy diet, that of course, they are really, very much important factor where, women can keep their sort of, healthy life, a healthy lifestyle, and they could remain healthy. Uh, there's another issue, which normally when women, they, go into that phase, they feel like first thing they do not accept it, and they go in more sort of depression, and I'm talking about menopause. Menopause is a sort of kind of issue where first thing, it most of the women, what happens to them, that they get a big shock. Oh, is it like, how come menopause, they don't accept it. But then again, like, a lot more ladies, they go into depression as well, like, so how to deal with this first, like, of course, with menopause, and is it something easily, dealing with? And of course, for those women who feel like first thing they do not accept it, and then for those women who go into depression, so what could be the solution for that about menopause, if you want to say something?
Okay, that's menopause doesn't mean that that's the end of the life. That is the start of the midlife. So the women should have, usually the women, they start experiencing now they are not menstruating anymore, or they are not fertile now. So that's a
Mhm.
setback. They start thinking about that. So they shouldn't think like this. It's not the end of the world. It's the start of a new journey. It's a transition in a woman's life. Yes, but this transition, unfortunately, is not very good for some females. They do experience some kind of mood changes, hot flushes,
Right.
disturbance in sleep. Yes, menopause. Menopause doesn't start like this. It starts from the age of 35 to 40. The women started experiencing the perimenopausal symptoms.
Yeah,
Then
yeah.
comes the menopause, and the
Mhm.
menopausal age in Pakistan and Asian countries are from like 40, 45 till 55. Right? It
Yeah,
varies in
yeah, yeah.
Western countries, and it varies genetically also. Some families, like if your mother is having a menopause at the age of 55, then you are lucky enough to have a good time left. So it varies from like genetic makeup also. But
Mhm.
yes, once a woman is having a menopause, she will experience mood swings, night sweats, frozen shoulder, joint pains, and
Mhm.
as I already mentioned, osteoporosis is a one of the big risks a women can have during this phase. The reason being the estrogen levels are going down, and the
Yeah.
calcium absorption within the body is not like the way it was before. That's why I'm already emphasized that a good reserves in the body is very must, because if you are taking calcium at the start of puberty and you have a good reserves, so your menopausal symptoms will not bother you, and the osteoporosis will not damage you in a way if you are having a good reserves. But if
Mhm.
you some for some reasons you don't have the good reserves, then osteoporosis can hit you way better, right?
Right.
So,
Mm-hmm.
at the age of 40, I already mentioned the woman should start taking calcium supplements. Vitamin D levels should be in a good position, because if the vitamin D will not be there, the absorption of calcium is not good at all. So, vitamin D and
Mm-hmm.
calcium, they are interlinked to each other. So, if you're
Right.
taking good vitamin D, then your calcium absorption is good. So, and then iron reserve should be good, because at menopause the estrogen level goes down. With the
Mm.
decrease in the estrogen, your skin will become, brittle, thinning of the hair. You don't feel good. Yes, anxiety, depression, mood swings, sleepless nights, insomnia. Usually, a women can experience. So, yes, these symptoms can be catered through a good hormone replacement therapies. If
Mm-hmm.
your symptoms are too bad and you are unable to cope up with these symptoms, yes, the treatment options are also available, where we just use the different hormones in the form
Mm-hmm.
of combination of estrogen and progesterone, or progesterone only or estrogen only. So yes, the women can, but again, the proper physician will help you that what kind of hormones you are in need of. You
Okay.
can't use the hormones by your own, right? But
Mm-hmm.
yes, the body should respond in a different way. Everybody respond in a different way to menopause, but not
Mm-hmm.
every women can need, they are in a dire need of hormone replacement therapy. These minor things like hot flushes, night sweats can be taken care of. Again, your lifestyle is very important. I always emphasize that your lifestyle modification and your diet plays an important role. That's a building block on which your body will survive, right? So
Mm.
hormone replacement therapies are there for the menopausal women. If you are experiencing too much of the symptoms because of the low estrogen level, you can go for different options. Exercise daily, good calcium intake,
Okay. Yeah.
and a group of good friends to socialize. That is also very
Right.
important.
So mental health is also important. Mental
Yes,
health goes
yes,
like, side by side with the physical
yes,
health. Yeah,
yes,
I would
yes, yes,
definitely fully agree with
yes,
you that.
yes,
There's another issue, what I've just heard since long about, women, about ladies, thyroid. That is the
yeah,
biggest issue in ladies. What do you think
yeah.
would be the causes of thyroid and prevention, if you can say something on that? The thyroid.
So if a woman is having thyroid issues, first of all, she should consult a physician, and they'll check
Mm-hmm.
the hormonal levels. There are certain thyroid function tests available, T3, T4 levels, and the TSH level. If someone is having hypothyroidism, the symptoms are different. If it's hyperthyroid, your thyroid is functioning abnormally high, then the symptoms are different. But if you are having hypothyroidism, the medication is different. Hyperthyroidism, the medication is different. So in that case, instead of self-medication, a proper test and a physician consultation is very important, because
Mm-hmm.
both the problems, hyper and hypo, carries its own risks, right? So
Mm-hmm.
if you are having like night sweats, increased body weight, or if you are experiencing some kind of symptoms like it's the cold outside but you are feeling heat and you are sweating, so in that case, if you're gaining weight without any reason, you
Mm-hmm.
are having a proper lifestyle, you are eating healthy, you are mobile, you don't have a sedentary lifestyle, but still you are gaining weight. These are the alarms, and then one should consult a doctor immediately that there must be some dysfunction of the thyroid that can lead to these symptoms, right?
So these are the symptoms. But what do you think? What cause for thyroid? What do you think that been ignored and developed the thyroidism?
So
Maybe
thyroid, see,
pre.
thyroid
Yeah,
is a gland. It's a gland that secretes thyroid hormone,
yeah.
and yes, if there are areas in which there's iodine deficiency, that can lead to the thyroid problems. But sometimes the hormone itself, there's a genetic factor as well as the environmental factors.
Right.
So it varies from person to person. But if
Uh-huh.
you're having these symptoms, you should consult a doctor. But there's no like specific cause or specific deficiency. Yes, iodine deficiency can lead to a lot of thyroid problems and the
Hmm.
genetic factors as well as an environmental factors.
So can it be treated through medicine, or
Yes,
there would be other ways as well?
yes, the medications are available for hypothyroidism, and if the symptoms are unbearable, if a person is having goiter, a big and large thyroid, then they can have surgical interventions are there. So thyroid hyper and hypo, both the cases are treatable, and
Hmm.
but uh, regular endocrinologist visits, regular uh, medical checkups are advisable in that
Hmm.
case.
Right. Now we would talk about a little bit towards the gynae side, and the basic, the main issue normally women they have it like they have the PCOS issue, like polycystic ovary syndrome. I mean, how does it develop? And again, the causes of it, the prevention of it, the treatment of it. Stage is yours, please. If you want to say something on
Yeah, yeah.
PCOS, please go ahead.
Polycystic ovarian disease basically starts at the age of puberty. We missed it for certain
Uh,
reasons, but
mhm,
once the women enters the fertility age,
mhm.
even at the time of fertility, we diagnose it as that the girl is having the PCOS. So polycystic ovarian is basically it's a form of like abnormal functioning of the ovaries in which the ovaries are producing excessive hormone androgens. The
Mhm.
androgens can lead to fluctuation of different kind of hormones within the body, and the female experience different kind of symptoms, including irregular menstruation, heavy bleeding, or less bleeding, irregular monthly cycles. They do have facial hairs, hirsutism. We
Yeah.
use that term hirsutism. They have the blackening of the skin
Mm.
in the in certain areas, and they have abnormal weight gain. These are all the
Yeah.
symptoms of PCOS,
Mhm.
and it's because of the abnormal increase in the androgen levels, which the ovary is secreting. So this can lead to all these symptoms. So basically, the high androgen levels as well as insulin resistance, that is the main
Mhm.
cause of polycystic ovarian disease.
Oh,
And once if a female is having the facial hair, usually the women they don't have the beard like hair on the face. And if you see a girl having the thick beard like
yeah.
hair on the face, on the chin, or if she's having abnormal blackening of certain areas around the neck, in the armpits, these are all pointing towards increased insulin resistance. We call
Right.
this term of blackening of the areas as acanthosis nigricans. This is a
Mhm.
condition because of the increased insulin levels within the body. And we usually miss these.
Mm.
Come across a lot of females coming to us that, see, doctor, we are having, the blackening of the necklines, the areas around
Yeah.
the neck, and the armpits. That's not normal at all. If you're having
Right.
excessive black armpits, the groin areas, and the around the neck, then you should have a good checkup. You must have insulin resistance. You can develop diabetes in future, weight
Yeah.
gain. So all these symptoms can suggest towards can point it out towards the PCOS, and the doc they should consult a gynecologist or a family physician.
Mhm.
And the first thing a girl can do is that she should start if she's overweight, you should work on this. You should start exercising. And I'm telling you that exercise and good lifestyle helps a lot as compared to taking the medications. Not every disease, the start of the good lifestyle along with the good diet is very helpful in PCOS. If you are
Mhm.
very mobile, you are exercising, your insulin level automatically comes down. If you are taking a proper exercising schedule, and you are taking less carbs and high protein diets, in that case a lot of symptoms usually settle down
Mhm.
without taking medication. But if the symptoms are there, specifically the menstrual cycle is not normal, women is experiencing heavy menstrual bleeding, or the cycles are missed, or they're having irregular menses, then she should consult a gynae or a family physician.
Right. Thank you so much, doctor, for sharing all this information in detail. Another issue, it is also related to gynae, and I would want you to shed some light about fibroids, so that my audience can also understand about, because most of the time what happens, they mix up all these kind of issues, whether you call it cyst or whether you call it fibroids, they just mix it up. They do not have a clear understanding, okay, what are fibroids, or what are like the other cysts, or for more information, what do you think that would be your say on it? Would be your kind of thought on it? That to explain a little bit more about fibers.
Okay, these are the basically abnormal growths within the body, and these are not cancers at all.
Right.
to be very, these are the benign fibrous tissue within the body. So
Mm-hmm.
fibroids usually detected while the women, she comes across with the complaint of heavy bleeding, irregular menstrual cycle, or they have, different lower abdominal heaviness, lower abdominal pain, and on ultrasound we usually diagnose that a person is having, and fibroid. Uh, like if the size is too much, and if
Mm-hmm.
the size, usually the small fibroids, they don't bother the females too much, but if the
Yeah.
size of the fibroid is too much,
It's too
then
much.
the
It's
female
big.
can
Yeah.
experience, yeah, then the female can experience heavy bleeding, a
Yeah. Yeah.
discomfort in the lower abdominal wall, and a heaviness all the time, backache. So in that case, she should consult a gynecologist, and
Right.
their surgeries and different medical options are available. She should, consult a gynae in that case if she's
Mm-hmm.
experiencing any kind of heavy bleeding or irregular
Mm-hmm.
periods or missed periods. Then it's very important to consult a gynae.
Thank you so much, Dr. Sadia. You emphasized most on a healthy lifestyle and your diet, healthy diet. I mean, most of the time, what happens, women especially, they gain weight. Especially if I would give you those women who go through with C-section, for their delivery time, so they suffer more, they gain a lot more weight, where we can say, like, the lower abdominal side. So, I mean, is it possible that can get rid of this gain, or, weight gain, or, like, to maintain just after the surgery, and there won't be any issue? Yeah.
Yes. Uh, by the way, C-section has nothing to do with the weight gain. So it's
Maybe you
just
can
a
say a
lifestyle.
myth around, you can say a myth
Yeah, yeah,
around, but
yeah.
normally
It's a
people, they
myth.
consider it.
So
Yeah.
yeah. Just normal delivery has its own, benefits, and in case of emergency, if a woman is undergo some kind of like C-section, but the C-section has nothing to do with the weight gain. But the thing is, how early you have start your mobility and your exercise, right?
Hmm.
So
Hmm.
yes, C-section we usually, because it's a surgery, and usually we don't, the one is not as active as compared to the one who has undergo the normal delivery. But they do have, after like 6 to 7 months, or within 3 to 4 months, we tell women they can have walk, they can have a good diet, or they can start exercising after consulting their gynae or their doctor. Immediately after C-section, yes, they can take a break of like 1 to 2 months, and then after that they can have a walk. They can start walking. They can have a good diet, which is rich in proteins but less in carbs. That is the key to lose weight, right?
Hmm.
I am not a very fan of this kind of fad diets like keto and the
Hmm.
protein diet or Atkins diet. My
Yeah.
opinion is that if you are taking a healthy diet, a balanced diet, that is very important in losing a weight.
Hmm.
If it's a C-section and the woman is breastfeeding itself helps in women reducing the weight. So
Yeah.
I emphasize that the women should start breastfeeding to their child, as well as they should eat healthy, balanced diet. That's it.
Right.
She shouldn't be going to the fancy diets, the keto, and I'm not a fan of these kind of diets. So I'm sorry for all those who are into these kind of diets, but no, I usually recommend all my patients that instead of running towards these fad diets, one should have a balanced diet. Um, uh, uh, Allah subhanahu wa ta'ala has given a lot of natural fruits, vegetables
Definitely.
within the diet, which you can add and can have a
Hmm.
good, healthy lifestyle. This can aid in reducing weight. So, C-section, yes, C-section
Hmm.
is not a label that you can't do the exercise, you can't walk, you should sit on the bed for like 6, 7 months. No, usually we have a misconception that once you
Yes.
are having a C-section, so you're not
Hmm.
allowed to go for an exercise, you're not allowed to go for a walk.
Yeah.
I had two Caesar in
Oh.
my life, so the more you're mobile after consulting a doctor, the
Yeah.
more you lose weight early. But if you'll think about, now you're having a C-section, so you are not allowed to exercise, good after one year, 2 year, and then you will find out, oh, now I'm gaining weight, so I should exercise. No, it should
Hmm.
start immediately after consulting a doctor. That you should start a mild walk, and then with the help of a doctor, after consulting a doctor, you can go for strenuous exercise as well for reducing
Right.
weight.
Okay. Thank you so much, Doctor, on that. Again, there is one particular question. I think it has become a fashion. I think supplement industry is growing day by day, year by year, and we see in the market different sort of multivitamins. As we just discussed about, for women health, it's very much important that she should take care of her iron, her other major nutrients, especially like calcium, beta, vitamin B12. So, what do you think? I mean, like, only we should be wholly solely dependent on the diet, or women, because I remember the time when I've been through that stage, of having a child. So doctor recommended me like calcium, vitamin C. So some of the vitamins she gave me, some of I remember. So you think so that because by the time we used to have it, that like calcium or B12 or iron, and when I just forgotten, I forgotten that name of that nutrient. So, what do you think that we should just, wholly solely dependent on diet, or we should take some supplements as well, for keep it in like in a balanced way? What would be your say on that?
Okay, if you're having a deficiency, then yes, if you're too deficient for that particular mineral or vitamin, in that case, you can have the supplements to add a boost. But for normal, levels, a good diet, a good balanced diet can serve the purpose. But if the tests are positive, suppose your test is showing a deficiency of B12, in that case, you have to take the supplements to, balance or level up the levels. But if you don't
Mhm.
have any deficiencies, if you don't have any iron deficiency or B12 is good, a normal healthy diet full of all the minerals and vitamins and nutrients can serve the purpose. But if your doctors prescribe you, you are having like low levels of iron, then iron supplements, added supplements are needed. Otherwise, there's no need.
Mhm.
I hope this
Oh, okay.
answered your query.
Yeah, but additionally, it has some more I have to add up here. I think I forgot in that question also in the beginning. For a regular checkup, what do you think a woman should go in a year, like for those regular checkup? And then one thing more included in that, like suppose you said it about nutrients. I remember the time when I wanted to get a check of all the nutrients, and she said, like, it's not necessary that you have to go for for all the nutrients to just get a check of. I remember that only been checked for the iron deficiency, not even for calcium. So, what do you think that should go for a sort of regular checkup? Along with that, for checking all the nutrients, what would be a particular test for it to check all your nutrients? And when it should be advised to go for a proper nutrients checkup, and what would be the test for it, if you can just suggest it?
So once you're aging at the age of 30 to 35, one should go for a proper checkups. And again, see, Kiran, it depends upon how you are spending your life, how healthy you are eating. So it depends upon your lifestyle and your dietary habits. If you are eating healthy, you are mobile, you are exercising, then there's no need for the regular checkups. But if you're having the symptoms of body aches, bone pains, even at the age of 20, you should go and consult a doctor because there must be some underlying process and there must be some underlying disease why that's at that early age you're having the body aches, the knee joint pain. But if
Yeah, yeah.
you are healthy and you are leading a healthy life, in that case, 30, 35 is the right time that you could go for the basic, the tests,
Mhm.
including the CBC, in which they check the hemoglobin levels. And yes, for women, 35, 30 to 35, there are certain, cancers that are prevalent. So cervical cancer is very much in the breast cancer. So every woman at the age of, before 30, 35, they should go for breast ultrasound if even if they don't have a family history of breast cancer. And if you are having a strong family history of breast cancer, you should
Mhm.
go for regular ultrasound breast every year. And for those women who are above 35, they should go for a mammogram. That is important.
Yeah.
And for cervical cancer,
Hmm.
particularly for the females, the vaccine is available for the cervical cancer, and
Yeah.
it's at the age of 9 to 12. A female can get vaccinated for the cervical cancer vaccine, and they usually vaccine give the vaccine at the age of 9, and then within like 6 months to 12 months the second dose will be injected. But for some reasons, if you have missed that age, even up till 26 years, a woman can
Mm.
have the cervical cancer vaccine to prevent
Mhm.
certain strains of cervical cancer. 26 years, at
Right.
26 years they can have the three shots of vaccines at the age at like start, and then after like 2 to 3 months, and the third dose will be after 6 months. This is for 26 years old. Now a recent study I've been studying in 2018, now they are saying then till 45 years you can get the vaccine for cervical cancer. They can prevent you from
Yeah.
cervical cancers. So till 45 years, you can have the cervical cancer vaccine. In that case, three shots will be available for 26 to 45 years old females. So these things are important. The cancers are prevalent. Then certain diseases are prevalent in the females, and I told about it, the anemias and the vitamin B12 deficiencies. So these screenings are important in certain age. So 35, after 35, they should go for the routine tests, including CBC, the mammogram, ultrasound, the echo, ECGs, and the calcium levels, vitamin D levels, B12 levels. So all these are important. But again, if in
Right.
between before 30 you are having the symptoms, as I
Mhm.
already mentioned, if young girl is
Mhm.
having body aches and the bone pains, they should go and consult a doctor.
So one another question related to this, like uh, as you mentioned about like mammogram, of course, there are different certain kind of cancers, because I also kept in my mind that this question I would also ask, and you just said it, so I am going to connect it with that previous information or detail. Is something, what could be the major cancers you think so most likely in women as compared to men, so that they are more vulnerable for those cancers? Some of the major cancers name you gave already, but if I would reiterate and you would just add some more in that detail or information, please, Mike is yours, go ahead.
1 in 10 women is at the risk of developing breast cancer. See
Hmm.
how common it is. So, the
Yeah.
breast cancer is the most important and most prevalent. I mean, it's very common in females. So,
Hmm.
women should have a proper screening every year if she's
Hmm.
having a family history, or even if she doesn't have a family history, she should have a proper screening every year, because breast cancer is very important. Then comes the cervical cancer. Cervical
Yeah.
cancer is also very much prevalent in females, but breast
Hmm.
cancer is on the top. So, if you're a
Hmm.
female, you are fertile, you are into a productive age, you should have a proper screening for breast cancer every year.
Hmm. Okay, one question related to depression, especially you can call it like to those new mothers. Like, they always, not always, I would say, but I've heard a lot more different cases where new mothers, they have been through the postpartum depression. What do you think? It is a permanent sort of problem, or it could be sorting out, or like how severe could it be, meaning like if a girl or a new mother is suffering with that sort of postpartum depression, so could it go more worst, or is more like easily dealing with, and if it could go worse, how severe could it be?
Okay, that's a very good question and very important. So, postpartum depression
Mhm.
is basically depression after pregnancy. And
Mhm.
pregnancy itself is a process in which a woman is undergoing a lot of physical as well as emotional changes. As I already mentioned, the body is changing its shape, a woman is gaining
Yeah.
weight, she's like day by day she's seeing that her figure is not the one which she was having before. So a lot of physical and emotional and psychological changes women is undergoing, and that is very important. So immediately after pregnancy, women usually suffer from baby blues. We call this term as
Mm.
baby blues.
Yeah.
What baby blues is,
Yeah.
I mean, it's very normal that a woman is having the mood swings. She started crying on different things. She's having difficulty in sleep. She's having a mild anxiety, and it usually remain for 3 to 5 days till like 2 weeks. But if these symptoms get worsened and the woman is experiencing excessive crying, mood changes, anxiety, depression, she is not talking to any family member, and sometimes they disown their own babies if they are having, you know, any kind of severe depression after delivering a child. We label this as postpartum depression. Baby blues are the initial phase of every woman experience after pregnancy. But if this period prolonged and the woman she is having a lot of mood swings, excessive crying here, and they are having sleepless nights, and they are having poor appetite, poor, loss of interest, and they are having depressed mood. We label this case as postpartum depression, and immediate medical help should be advised in that case, because a female can have the suicidal thoughts, or they can harm the baby, they can harm themselves. So it's very important. If a person is having depression, even if it's not a postpartum depression, um, he or she cannot judge that they are suffering from depression. It's the duty of the family or the caregiver within the family or the husband in case of postpartum depression, that they should identify, they should see that the person is not normal, it's not behaving normally, so they
Yeah.
should seek medical advice in that case.
Definitely. Thank you so much, Dr. Sadia, for responding. On this question, we are just about to wrap up after a few questions. Maybe you can say a few more questions, and then we would wrap up the show. Uh, One another thing about, as we did discuss about some sort of hormone disbalance in the beginning. What do you think in women, hormone disbalance occur? At what age? And when this occur, what could be the symptoms of hormone disbalance in women? If you can just shed some light on that as well.
Okay, see, it's a hormone. Our body is basically revolve around different hormones for different kind of
Mm-hmm.
activities, and unfortunately, the females, they in their life, the hormones plays very very important and crucial role at the time of puberty, at the time of pregnancy, and the menopause. So all the three stages revolve around different kind of hormonal changes. Puberty itself is having, and all the changes which a woman is experiencing is related to hormonal changes. If
Yeah.
you are entering a puberty, yes, the estrogen, progesterone levels are increasing, and the woman is having developing, the body character. They are enlarged breasts, pubic hair, and if there's some kind of disbalance or abnormality, then they can have irregular menstrual period, or the PCO is one of the leading cause in which a woman is having disbalanced hormones, right? And then you talked about thyroid, hyperthyroidism, and
Yeah.
hypothyroidism. That is also related to hormone disbalance. Then
Right.
there are certain other hormones within the body, and major depressive illness is also related to some kind of, the neurotransmitter and hormonal disbalance. The cortisol is the culprit in case of stress. If you are having a lot of stress, that means your body is having high cortisol levels. High cortisol level carries itself a lot of risk within the body. So because cortisol levels plays a very important role in our daily life day activities. So hormones play a very important role in the life of a female. So there are different diseases related to different kind of hormonal imbalances, and there are different symptoms I already mentioned. So if you are having this kind of symptoms, gynecologically you are having irregular periods or hirsutism, you should go and consult a doctor immediately in that case.
Okay, thank you so much for responding on this question. Dr. Sadia, I have heard about one disease, and I've just, noticed and observed that this occurred in a young girl, especially you can say hardly a teenager, 16 years old, 17 years old, about scoliosis. What could be the reason of suffering with the scoliosis in a young girl? And is it preventable? Is it treatable? And what are the causes of suffering with this scoliosis, especially in young girls?
Okay, scoliosis sometimes, it can be a cause. It could be because of some kind of injury
Hmm.
or things like that. So, if a person is having scoliosis or in young girl, they should have a proper, medical uh, checkups for that. Scoliosis basically it's a abnormal posture. If a person
Yeah.
is Yes, scoliosis is very common in females and males nowadays because of the use of constant mobiles and this laptops. If your posture
Hmm.
is not good, you can
Hmm.
have the scoliosis in future. So
Hmm.
a good posture and again a good exercise schedule prevent you from having scoliosis. But once
Hmm.
you're having scoliosis because of the constant postural abnormalities, or you are in habit of, the life nowadays is very busy, and every person is sitting next to the laptop, and your posture is not good, and you're, typing, and your
Yeah.
posture is not right. There's a proper level one should keep while using the laptop. And I always emphasize that the posture plays an important role, and it prevents from a lot of spinal abnormalities and spinal injuries. So if a
Hmm.
person is having scoliosis, sideway curve, yeah, if a person is having this kind of problem, so they should immediately consult a doctor, and the doctor will, refer them for physiotherapist, or they can refer from different holistic approaches to improve that posture with a lot of exercises and physiotherapy. Yes, the posture can be improved, but sometimes the surgical intervention is also necessary.
Thank you so much, Doctor. Few more questions, maybe one or two. In this, what do you think? Of course, what did you experience? If you talk about data, the leading cause of death rate in women. And do you also think that heart disease could also be because I think I was just checking somewhere the data, specifically for Pakistan. I'm not really sure because I've forgotten that, but I was just checking up the data for especially for Pakistan. And I said it, I saw it, that the leading cause of death in women in Pakistan actually is the heart disease. What is your experience, if you can share, please?
Okay, see, again, the in Pakistan, unfortunately, the women, they don't take care of their health as the
Yeah,
women in West, right?
yeah, of
So
course.
they are, maybe because of their personal, lifestyle or personal reasons, and the dietary habits, and the concept of females, that yes, now they have given birth to the children, the life is over for them. But
Hmm.
this misconception should be cleared, that
Yeah.
once you are having a family, you have kids, you should keep yourself fit and fine and healthy,
Mhm.
for to prevent yourself from a lot of heart diseases, diabetes, and hypertension. So if
Yeah.
your body is fit, you're not obese, you're not overweight, then you don't have that much risk of cardiovascular diseases, diabetes, and hypertension. But if you're obese, your lifestyle is not good, your eating habits are not good. By eating habits, I mean you're not eating on a proper time, you're taking a dinner at like 2:30 a.m., or you
Mhm.
are
Yeah.
skipping your meals, and you don't have a proper schedule for eating. In that case, you'll gain weight. With weight gain, weight gain
Mhm.
itself carries a risk of cardiovascular disease. That's why
Yeah.
in females in
Mhm.
Pakistan, the percentage of females are more because of their sedentary lifestyle, because they are not as active as compared to males. Secondly, the menopause. The menopause itself
Mm.
carries a risk of diabetes, hypertension, and cardiovascular diseases. So
Mm.
If you are having a balanced diet and your weight is not much, and you are according to your BMI is good,
Mhm.
there are very less chances of having cardiovascular disease. But if your BMI is high, BMI is body mass index, which tells you how obese you are. If you are not obese, you are having a healthy lifestyle, you are active physically, then you can prevent yourself from a lot of cardiovascular diseases, hypertension, and others.
Thank you so much, Dr. Sadia, for this lovely session. And I hope that it would definitely add value to my audience, especially women, because this session and this show, especially for all the women. So, what do you think, Dr. Sadia, would be the last message you would like to give to all our lovely women around, and would tell them, would suggest them to debunk or to get rid of those myths, or the taboo, which they always just, get themselves entangled, and they always think that, oh, okay, I'm like, this is something we have heard, this is something we understood, or maybe, adapt from the society. So, like, I mean, like, their love is done. They can't take another step to revive their energy, to revive their life, and to get a proper life again. So last message for all the lovely women, what would be that? Please go ahead.
Okay, it's just my message is that it's not just the physical health, your mental
Mhm.
health matters a lot, right?
Right.
If you're a
Mhm.
female, if you are physically good but you're not mentally good, that means you are in trouble, right? And
Mhm.
the key to good health is that you should be physically active as well as emotionally stable, right?
Mhm.
So, unfortunately, as females, have to juggle, different roles on a daily basis. But your own physical health, your self-love is very important.
Yeah.
We as females should love our bodies, should love ourselves, should take care of ourselves. As I told you, that women is the backbone of the family. If you are
Definitely.
not strong, your whole family will collapse. Your children are dependent. Your husband is dependent on you. So if you're not strong, you will not be able to carry out your responsibilities. And if you'll not be able to carry out your responsibilities, then things will be different. So self love and time, take out the time for yourself. Self love and
Mhm.
self care is very important. That's a very important. So today, the take home message for a female should be that if you're falling in any age, whether it's like puberty, or you are in the middle age, or you are above 50 or above 60, that's not the end of the life. You are a
Mhm.
female. God has given you a lot of good things to cherish. So enjoy your life, self care, love yourself, and take good care of yourself.
Thank you so much. On this last note, I would definitely add up here that love yourself, because women is a backbone of the family. And if a backbone got dyscoliosis, so definitely the family would be disrupted and crooked and not going to go, straight or erected. So thank you so much for this lovely session, Dr. Sadia. And soon I'm going to see you for another session for another topic. Until you take good care of yourself and you have a lovely day. Bye bye from my side.
Thank you so much, Kiran, for having me here, and thank you so much for the lovely audience for hearing me. Definitely, I'm looking forward to the next section. Thank you.
Thank you so much. Bye. Have
Bye.
a lovely day. Bye bye.
Same.